Hi, this is Dr. Roessler with Reed Physical Therapy, and today we're going to talk about the popping in your knees. So one of the questions we get a lot in the clinic is popping in your knees dangerous? So not necessarily. So a lot of times popping your knees can come and go on its own over the course of a couple days, and it's not always accompanied by pain. However, if you have prolonged knee popping, popping that goes on several weeks to several months, it is a sign that your joint is not moving correctly. So it's usually from one of two reasons. Either the joint is not moving correctly in between your shin bone and your thigh bone, which what we call the femur and the tibia. So that if you can imagine them having to move like this, slide and glide and roll, whenever you bend your knees, it means that there's something that's causing it to catch and then click down. So if that's happening, it may not be painful, but if it happens over a long enough period of time, the smooth surface that is in between the bones will start to wear down and rough up. It needs to be addressed through physical therapy. So the other thing that can happen is that you have your kneecap sitting here on top of the bones, and sometimes that kneecap can get a rough spot in it, and it can also catch as your knee starts to bend. So again, it may not be painful at first, but if it occurs over a long period of time, it can lead to that smooth surface underneath the kneecap starting to become rough. It's wise to treat this early. So if after a couple months of knee popping, or if pain begins to start consistently, if you don't address it early, then the problem can get worse, and leads to the need for either more physical therapy, or in severe cases, knee surgery. Hope that helps. Thank you.